Hello and welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the broadcast portion of our show, so let's get started. Via email, ankle joints. Could you talk more about ankle joints, please, and how is the development of ankle replacement coming along?
Well, it's kind of gone backwards and forwards, probably. My partner's father started the first ones. It took him several years, and he set an airplane to fly back and forth to Indiana to get the design right. The problem has been it's a small joint. It's had plastic issues like we have other joints. It's gotten better. It's not meant for a high demand person. It's best for people who are a little lower demand or are willing to take lower demand. And it too has a higher revision rate than hips or knees.
Okay.
The other option is ankle fusion for younger people who are unwilling to follow those rules. Very successful, but it leads to further foot and ankle problems. But it's a good in-between for many folks.
Okay. 77-year-old man from Orange City, Iowa, had a knee replaced 20 years ago and is wondering what the life expectancy is for that knee before he should think about getting it replaced.
Right about now.
20 years?
Yeah, well, he should. The 20-year-old knee, most of the ones I'm redoing now were put in the 90s, and that would put it in that group. He should at least have some x-rays to see how bad the plastic's worn. If his own surgeon's retired, certainly another orthopedic surgeon that comes there from CNOS out of that area would be able to look at those pictures and say, here's your wear. Hopefully have an x-ray to compare to and tell him how much wear and how much time he's got left.
Okay. Comment, only 84-year-old woman from Mitchell. I have had 3 hip replacements done. I had no problems with recovery, could walk within a week.
Fantastic, about as good as you could ever hope.
84, doing great, 3 hip replacements. I know that you only have 2 hips, so probably had to redo one.
There was a redo one. A redo to do that well is pretty good because you're going back through scar, harder surgery, you expect a longer recovery, more difficult surgery too.
Okay. 66-year-old man from Alcester. I just had hip surgery. Does anyone go back in after surgery for a cortisol injection?
I would think cortisone in the hip, but the answer is you don't want to put steroids in total joints. We know it increases their. You don't want to put needles in, first of all. It's always risky for us. We do it to look for infection, but to put things in a hip after it's replaced,
you could introduce an infection.
You do not want to do that. You could inject the bursa. We talked about that earlier, the IT band, but not the hip proper. That would be no.
All right. 70-year-old man from Marion. If a man has been on 5 milligrams of prednisone for 5+ years, how would this affect his hip bones and joints in general?
Well, we know how much, but we know the steroids, prednisone, soften cartilage. It's a known fact. It inhibits prostaglandins, which cartilage needs for synthesis and fluid. It will weaken his bones, and if he's on, that's not a high dose, but that dose.
Not that bad.
But he probably should think, even as a male, should have a bone density study to see what he's at. And he isn't a high risk for AVN like some of my patients that take high-dose steroids for a prolonged time for different medical problems.
I like the idea of increasing walking so that it enhances the bone strength, and I would contend that an exercise program is heads and shoulders over the Fosamax or any of the bone.
We've seen many problems. I wish I could tell you as an orthopedic surgeon those drugs have been great. We've seen fractures from them. We see a lot of GI problems, and I tell my patients if you're going to take those drugs, which I think there may be a place, look in 4 or 5 years, stop them, get a holiday, and look at other options that are coming.
I think the better option is a regular exercise, weight-bearing, one exercise is slight hopping so that you can strengthen that bone.
Walking's about as good as, if we can get people to walk, you'll help me a ton.
Boy. 62-year-old man from Rapid City has had both hips replaced. It's difficult to get the legs the same length.
It depends on where you start. Certainly that's our challenge in surgery. The first guy gets it easy. The second one, you got to balance it. There's more factors than just the hip that don't, because your femurs may not be the same length from a kid or a broken leg. If they're equal to start, it means the surgeon might have added or subtracted to get the muscle tension right. If it's way off, you need a lift in your shoe. You build up the short side, obviously, and you can put a certain amount in the shoe and the rest is out. A redo surgery for that, complicated, but there's a few that just get so far you have to. It's not the first choice. A buildup of a shoe would be the first choice if it's not too severe.
Okay. So, I mean, and that it just happens, doesn't it? I mean, what is the right length?
In surgery, we do have some ways to measure. The problem if you had a previous fracture, or you measure before you start, you do an x-ray, you try to judge and get in the park. The prostheses we have now are pretty easy, but say you can't get it in just right, do you hit it harder to break something, or do you leave it a little long, try to add a shorter ball? There's some pieces that you can adjust, but it is a bit of a Kentucky windage sometimes trying to get it, but we can get within a 1/4 inch.
Kentucky windage?
You look at it and think you're the best you got, and you kind of give it a little eye and hope that that's right. But we do have some measuring things that we can do in surgery with x-rays to help us. And now computer surgery has helped us with that a bit as well.
All right. Man from, in other words, yeah, it's hard to get it just the right length.
Yeah.
Man from Sioux Falls, is there any way to strengthen the bones to prevent a break? We talked about that. My favorite is an exercise program.
Yeah, walking for sure. If you can't walk, I got nothing I'm going to do to help you. No drug is going to help you. If you don't have weight-bearing exercise, calcium and vitamin D, there's no bone that's going to get stronger.
And there's some new data. Have you heard this? Women who have vascular disease of some kind, history of some vascular disease, if you put them on calcium, it worsens the stroke risk.
You got to be careful about the calcium in all groups. Just like the glucosamines we see, primarily supplied to patients, there's some cholesterol patients that should consult their doctor before they take glucosamine over the counter.
Yeah. I would say vitamin D, 2,000, forget about the calcium supplement. Would you agree?
I would say in people, unless they have other risk factors, I look at some people who are early post-hormonal or have had gastric bypass or abdominal problems, they got to be careful because they don't pick up calcium out of their diet.
Okay. 78-year-old man from Sioux Falls just had a scope surgery in left knee a month ago. 2 tears of the meniscus came out of surgery extremely bruised, groin to heel. I was wrapped tight with ace bandages. Is this usual to have so much bruising?
The bruising probably came from the tourniquet. When you do a knee scope, often we have a tourniquet and it's squeezed tight in the thigh, and I'm guessing the bruising wouldn't come from the knee. Typically with the scope, the blood would stay in the knee. I'm guessing the bruising came from the tourniquet because it squeezed on his thigh and it leaked the veins a little bit.
And he took his aspirin up and too close to the
Could have
time
been,
of the
but
surgery.
I would guess tourniquet more than knee on that case.
Via email, what causes bursitis? I sit at work all day. Can that cause bursitis? And if so, what can I do to relieve it?
Get up frequently and get about. Bursitis is basically a blister. Bursa is a normal fluid accumulation between tendon and bone or between tendons. It's a lubrication. You're supposed to have the bursa. Yeah. It gets pathologic when it gets thick and full of stuff from irregularity, and unfortunately sitting doesn't help it. Cross-leg sitting is worse for it. Stretching would help it, but not sitting all day would be a benefit. And probably if you sit all day and get bursitis in your hip, I would worry your back may have a bit of a problem as well.
So get moving and start gradual.
Yeah, you need exercise. Sitting all day we know has no good. Sitting is the worst exercise we can do.
Yeah, sitting.
Yes.
Yeah. Do any replacement hips have a 2-piece stem and ball so the ball could be replaced without having to reinsert the new stem?
Yeah, almost all the ones now, some have 3, that's been a problem for us because had too many pieces. Almost all the balls can be taken off. When you change the cup to put a new plastic in, you take the ball off, put a new ball on, and put a new liner in. So almost all the new ones that are currently available are 2-piece.
So replaceable. 62-year-old woman from Aberdeen, I've inflamed bursa in my hips, and I developed one by my ischium. What are these?
The one at your ischium is kind of uncommon. I would guess that's your back. When you say your tailbone or that area hurts, I'm guessing you have a low back issue. Your ischium is where your hamstring's attached. So there's a bursa there, but it's not unless you're doing a lot of hamstring exercise. I doubt it. So I'm guessing that's going to be your sciatic nerve. I think you have a back problem. If you tell me that in the office, you hurt in that part of your anatomy, almost always that's a sciatic nerve. Yeah.
I've heard that when it's in the groin, that's hip. When it's in the back or wrapped around or go down the leg, almost all of those are back problems.
Yeah, there's a lot of people have both, but that's the general rule that'd be very true. There's a few back patients have groin pain, but groin pain would be more hip, and that pain you described down the leg, better talk to a back person first. Yes, sir.
Jeff, it's been a great pleasure to have you here. Thank you very much for joining us.
Thank you for inviting me.
And thank you for joining us on our website. We appreciate all your questions and the opportunity to answer them.